Pulmonary edema is a condition brought about by overabundance liquid in the lungs. This liquid gathers in the various air sacs in the lungs, making it hard to relax. As a rule, heart issues cause respiratory edema. Be that as it may, liquid can gather in the lungs for different reasons, including pneumonia, openness to specific poisons and prescriptions, injury to the chest divider, and heading out to or practicing at high heights. Respiratory edema that grows out of nowhere, intense pneumonic edema, is a health-related crisis requiring prompt consideration. Pulmonary edema can once in a while cause demise. The viewpoint improves in the event that you get treated rapidly. Treatment for respiratory edema changes relying upon the reason, yet by and large incorporates supplemental oxygen and meds. Indications. Pulmonary edema signs and manifestations may show up abruptly or create over the long haul. The signs and manifestations you have relies upon the sort of aspiratory edema. Abrupt, intense, aspiratory edema signs and side effects. Trouble breathing, dyspnea, or outrageous windedness that deteriorates with movement or when resting. A sensation of suffocating or suffocating that demolishes when resting. A hack that produces foamy sputum that might be touched with blood. Wheezing or heaving for breath. Cool, damp skin. Tension, anxiety or a feeling of fear. Somewhat blue IPS. A quick, sporadic heartbeat, palpitations. Long haul, ongoing, aspiratory edema signs and side effects. Trouble breathing with action or when lying level. Arousing around evening time with a hack or winded inclination that might be soothed by sitting up. More windedness than typical when you're actually dynamic. Wheezing. Fast weight acquire. Growing in your lower furthest points. Weakness. New or demolishing hack. High height aspiratory edema, HAPE, signs and side effects. HAPE can happen in grown-ups and kids who travel to or practice at high elevations. Signs and side effects are like those that happen with intense aspiratory edema and can include cerebral pain, which might be the main side effect. Windedness with action, which deteriorates to windedness very still. Diminished capacity to practice as you once could. Dry hack, from the outset. Afterward, a hack that produces foamy, pink sputum. A quick heartbeat, tachycardia. Shortcoming. Chest torment. Second-rate fever. Signs and indications of high-height pneumonic edema, HAPE, will in general deteriorate around evening time. When to see a specialist. Aspiratory edema that goes ahead abruptly, intense pneumonic edema, is hazardous. Call 911 or crisis clinical assistance in the event that you have any of the accompanying intense signs and indications. Windedness, particularly in the event that it goes ahead out of nowhere. Inconvenience breathing or a sensation of choking, dyspnea. An effervescent, wheezing or panting sound when you relax. Pink, foamy sputum when you hack. Breathing trouble alongside a great deal of perspiring. A blue or dark tone to your skin. Disarray. A huge drop in circulatory strain bringing about unsteadiness, discombobulation, shortcoming or perspiring. An abrupt deteriorating of any of pneumonic edema indications. Try not to endeavor to drive yourself to the emergency clinic. All things considered, call 911 or crisis clinical consideration and hang tight for help. Causes. The reasons for aspiratory edema fluctuate. Pneumonic edema is assembled into two classifications, contingent upon where the issue began. On the off chance that a heart issue causes the aspiratory edema, it's called cardiogenic pneumonic edema. Regularly, the liquid development in the lungs is because of a heart condition. On the off chance that aspiratory edema isn't heart-related, it's called non-cardiogenic pneumonic edema. Now and again, pneumonic edema can be brought about by both a heart issue and a non-heart issue. Understanding the connection between your lungs and your heart can help clarify why aspiratory edema may happen. How your lungs work. Your lungs contain some little, versatile air sacs called alveoli. With every breath, these air sacs take in oxygen and deliver carbon dioxide. Regularly, this trade of gases happens without issues. However, once in a while, the alveoli load up with liquid rather than air. keeping oxygen from being assimilated into your circulatory system. How your heart functions. Your heart is made of 2 upper and 2 lower chambers. The upper chambers, the privilege and left atria, get approaching blood and siphon it into the lower chambers, both ways ventricles. The lower chambers siphon blood out of your heart. Ordinarily, deoxygenated blood from everywhere your body enters the correct chamber, then the correct ventricle, where it's siphoned through enormous veins, aspiratory conduits, to your lungs. There, the blood discharges carbon dioxide and gets oxygen as it streams by the alveoli. The oxygen-rich blood at that point gets back to one side chamber through the aspiratory veins, moves through the mitral valve into the left ventricle, lastly leaves your heart through the biggest vein in the body, called the aorta. The heart valves keep blood streaming the right way. The aortic valve holds the blood back from streaming in reverse into your heart. From the aorta, the blood goes to the remainder of your body. Heart-related, cardiogenic, pneumonic edema. Cardiogenic pneumonic edema is brought about by expanded pressing factors in the heart. It's normally a consequence of cardiovascular breakdown. At the point when an infected or exhausted left ventricle can't siphon out enough of the blood it gets from your lungs, pressures in the heart go up. The expanded pressing factor pushes liquid through the vein dividers into the air sacs. Ailments that can cause cardiovascular breakdown and lead to aspiratory edema include coronary course illness. Over the long run, the corridors that supply blood to your heart muscle can get restricted from greasy stores, plaques. A lethargic narrowing of the coronary conduits can make the left ventricle feeble. Now and again, a blood coagulation structures in one of these limited conduits, impeding bloodstream and harming some portion of your heart muscle, bringing about a coronary episode. A harmed heart muscle can at this point don't siphon just as it ought to. Cardiomyopathy. This term implies heart muscle harm. In the event that you have cardiomyopathy, your heart needs to siphon more diligently, and pressing factors go up. The heart might be not able to react to conditions that expect it to work more diligently, like exercise, disease or an ascent in circulatory strain. At the point when the left ventricle can't stay aware of the requests that are put on it, liquid upholds into your lungs. Heart valve issues. Narrowing of the aortic or mitral heart valves, stenosis, or a valve that releases or doesn't close as expected influences bloodstream into the heart. The heart needs to work more enthusiastically, and pressing factors go up. In the event that valve spillage grows abruptly, you may create unexpected and extreme aspiratory edema. Hypertension. Untreated or uncontrolled hypertension can extend the heart. Other heart issues. Irritation of the heart muscle, myocarditis, intrinsic heart abandons and strange heart rhythms. Arrhythmias, additionally may cause aspiratory edema. Kidney sickness. Hypertension because of limited kidney courses, renal conduit stenosis, or liquid development because of kidney infection can cause pneumonic edema. Ongoing ailments. Thyroid infection and a development of iron, hemochromatosis, or protein, amyloidosis, likewise may add to cardiovascular breakdown and cause aspiratory edema. Non-heart related, non-cardiogenic, respiratory edema. Aspiratory edema that isn't brought about by expanded pressing factors in your heart is called non-cardiogenic pneumonic edema. Reasons for non-cardiogenic pneumonic edema include intense respiratory trouble condition, ARDS. This genuine problem happens when your lungs unexpectedly load up with liquid and provocative white platelets. Numerous conditions can cause ARDS, including serious injury, far and wide disease, sepsis, pneumonia and extreme dying. Unfavorable medication response or medication glut. Numerous medications, going from ibuprofen to unlawful medications like heroin and cocaine, are known to cause aspiratory edema. Blood cluster in the lungs, aspiratory embolism. In the event that a blood coagulation goes from the veins in your legs to your lungs, you can create aspiratory edema. Openness to specific poisons. Breathing in poisons or taking in a portion of your stomach substance when you upchuck, gulp, causes extraordinary disturbance of the little aviation routes in alveoli, bringing about liquid development. High elevations. Pulmonary edema has been found in hikers, skiers, climbers and others who travel to high rises, as a rule over 8,000 feet, around 2,400 meters. High-height respiratory edema, hypertension. Untreated or uncontrolled hypertension can expand the heart. Other heart issues. Aggravation of the heart muscle, myocarditis, inborn heart forsakes and abnormal heart rhythms, arrhythmias, furthermore may cause aspiratory edema. Kidney infection. Hypertension as a result of restricted kidney courses, renal channel stenosis, or fluid improvement due to kidney contamination can cause pneumonic edema. Continuous sicknesses. Thyroid disease and an improvement of iron, hemochromatosis, or protein, amyloidosis, moreover may add to cardiovascular breakdown and cause aspiratory edema. Non-heart related, non-cardiogenic, aspiratory edema. Aspiratory edema that isn't achieved by extended squeezing factors in your heart is called non-cardiogenic pneumonic edema. Explanations behind non-cardiogenic pneumonic edema include extraordinary respiratory difficulty condition, ARDS. This certified issue happens when your lungs startlingly load up with fluid and provocative white platelets. Various conditions can cause ARDS, including genuine, injury, all-over sickness, sepsis, pneumonia and outrageous kicking the bucket. Troublesome drug reaction or medicine overabundance. Various drugs, going from ibuprofen to unlawful prescriptions like heroin and cocaine, are known to cause respiratory edema. Blood group in the lungs, respiratory embolism. If a blood coagulation goes from the veins in your legs to your lungs, you can make aspiratory edema. Receptiveness to explicit toxic substances. Taking in toxins or taking in a segment of your stomach substance when you vomit, objective, causes exceptional aggravation of the little flying courses and alveoli, achieving fluid turn of events. High heights. Pneumonic edema has been found in explorers, skiers, climbers and other people who travel to tall structures, generally speaking more than 8,000 feet, around 2,400 meters. High tallness respiratory edema. HAPE, for the most part happens in the individuals who don't initially get adjusted to the height, which can take from a couple of days to a week or thereabouts. Be that as it may, individuals who live at high heights can get HAPE with no rise change in the event that they have a respiratory disease. Close suffocating. Breathing in water causes liquid development in the lungs that is reversible with quick clinical consideration. Negative pressing factor pneumonic edema. Pneumonic edema can create after a blockage in the upper aviation route causes negative pressing factor in the lungs from extraordinary endeavors to inhale in spite of the blockage. With treatment, the vast majority with this sort of aspiratory edema recuperate in around 24 hours. Sensory system conditions or methodology. A sort of pneumonic edema called neurogenic aspiratory edema can happen after a head injury, seizure or mind a medical procedure. Smoke inward breath. Smoke from a fire contains synthetics that harm the layer between the air sacs and the vessels, permitting liquid to enter your lungs. Bonding-related lung injury. Blood bondings may cause liquid overburden in the left ventricle, prompting pneumonic edema. Viral diseases. Pneumonic edema can be brought about by infections, for example, the hantavirus and dengue infection. Hazard factors. Cardiovascular breakdown and other heart conditions that raise pressure in the heart increment the danger of pneumonic edema. Hazard factors for cardiovascular breakdown include strange heart rhythms, arrhythmias, liquor use, inherent coronary illness, coronary corridor sickness, diabetes, heart valve illness, hypertension, rest apnea. Notwithstanding, some sensory system conditions and lung harm due to approach suffocating, drug use, smoke inward breath, viral diseases and blood clumps additionally raise your danger. Individuals who travel to high elevation areas over 8,000 feet, around 2,400 meters, are bound to grow high-height aspiratory edema, HAPE. It generally influences the individuals who don't initially get adjusted to the rise, which can take from a couple of days to a week or somewhere in the vicinity. Kids who have existing pneumonic hypertension and underlying heart deformities might be bound to get HAPE. Confusions. Confusions rely upon the basic reason. By and large, if aspiratory edema proceeds, the pressing factor in the pneumonic conduit can go up, pneumonic hypertension. Ultimately, the heart gets frail and starts to come up short, and pressing factors in the heart and lungs go up. Inconveniences can include breathing trouble, expanding of the legs, feet and mid-region, development of liquid in the layers that encompass your lungs, pleural emission, clog and expanding of the liver. Prompt treatment is essential for intense pneumonic edema to forestall passing. Anticipation. You might have the option to forestall pneumonic edema by overseeing existing heart or lung conditions and following a sound way of life. For instance, you can diminish your danger of numerous sorts of heart issues by finding ways to control your cholesterol and pulse. Follow these tips to keep your heart solid. Eat a solid eating regimen wealthy in new natural products, vegetables, entire grains, without fat or low-fat dairy, and an assortment of proteins. Deal with your weight. Get normal exercise. Try not to smoke. Cut off salt and liquor. Oversee pressure. Forestalling high elevation aspiratory edema, HAPE. To forestall HAPE, step-by-step climb to high rises. In spite of the fact that suggestions fluctuate, most specialists prompt expanding rise close to 1,000 to 1,200 feet, around 300 to 360 meters, a day once you arrive at 8,200 feet, around 2,500 meters. A few climbers take physician-recommended meds, for example, acetazolamide or nifedipine, Adalat CC, Procardia, to help forestall signs and manifestations of HAPE. To forestall HAPE, begin taking the drug in any event 1 day before climb. Ask your PCP what amount of time you need to require for the prescription after you've shown up at your high height objective.